Non-communicable diseases are a global epidemic. It's not peculiar to developing countries, developed countries. It is universal. And ranked the #1 cause of death globally, and this takes no account of socioeconomic class. The World Health Organization reports that non-communicable diseases account for 63% of all annual deaths. This number would have 83%, which is roughly 29 million people in low and middle income countries. The high incidence of these non-communicable diseases, and for ordinary day-to-day Barbadians, it means that you can't catch it. But buried in that is a very important statement that Sir Trevor has made, and I will speak to it as well. The high incidence of the NCDs, the diabetes, the cancers, the cardiovascular diseases, and so on, and as you quite rightly mentioned, the chronic respiratory diseases, affects the progress of the MDGs, United Nations Millennium Development Goals, because, and we are committed to the MDGs, we signed on to them. In fact, I was the one at the time, because Prime Minister Arthur was not available to do it, to actually sign Barbados' commitment to these, because they speak to decreasing the incidence of major diseases, elimination of extreme poverty, and a whole host of their 8 MDGs to which we are committed. But the NCDs create not only a burden, a heavy burden too, on individuals, but also on our societies, because they drive up the cost of healthcare. And that then has a ripple effect, which will affect other areas of development that we need to be pressing forward with, matters like education, matters like climate change, and a whole host of other things which are not unrelated to this, to the NCDs. And this is an undesirable situation, further exacerbated by the simple fact that non-communicable diseases are largely preventable. You heard from Sir Trevor that they're mostly driven by unhealthy diet and lack of physical activity. In other words, we have to aim for the practice of self-care. And we have to be very mindful that we can self-inflict these diseases. If we continue to smoke, if we continue to eat the wrong foods, if we continue to sit down when we should be walking, moving, and that's what BARP is saying, just move, move. You don't have to run a mile, or you don't have to be doing physical, exercise all the time. Yes, you must do that sometime, every day if you can, but just move it. I don't sit down in front of my computer for more than an hour without getting up. Find something else to do, and there's always something else that you can be doing, which involves movement. And that is the message that we are bringing. Keep moving.